Hey everyone, Dr. Taylor here. So I want to run through another functional medicine test that we do on pretty much everyone. This is kind of like the general physical exam in functional medicine, and this is called an organic acid test. And it just covers so many different areas of the human physiology and biochemistry that's just a wonderful test to see some root cause issues going on within the body. So I'm going to run through this test. This patient actually came in for trouble with weight loss, having trouble losing weight, a lot of symptoms of depression and anxiety. So she really wanted to get to the root cause issues of why she was feeling the way she feels. So this test is going to really uncover issues for people that have trouble losing weight, have chronic pain, fatigue, people with autoimmune diseases, if they have irritable bowel syndrome, just a lot of chronic conditions. This test will help us uncover some of those root cause issues. So let's go ahead and get started. The first portion of this test is all about the intestinal microbial balance in the GI system. So we have all these different markers, and these different markers are just organic acids, or these are substances that yeast and fungus will produce into the bloodstream, and then the kidneys will filter these out. So if there's an abundance of these type of chemicals, organic acids within the urine, we can measure these different levels and tell if there's an overgrowth of yeast. And the two big ones are arabinose here, and the second one up here. If these levels are high, like they are in this patient, and you see her marks at 36 and 29, well, she has a Candida overgrowth within the small intestine. That's something we have to really look at, because Candida will trigger the immune system. They found people with Hashimoto's thyroiditis many times have an infection in their gut with Candida. And it's just kind of like that friendly fire that the immune system's trying to get rid of that Candida, but it can't, and it ends up attacking the thyroid at the same time, because the thyroid tissue looks a lot like Candida on the outside, so the immune system can't tell the two apart. So a lot of people with Hashimoto's thyroiditis, once they clear up the Candida, then the thyroid condition goes away. So that's huge with people trying to lose weight. If they have an underlying Candida infection, or a functional hypothyroid, or a functional decreased thyroid production. So that's a huge one that we start with, we look at. Next one is just bacterial markers. So people that have irritable bowel syndrome, this is pretty big. They're finding that a lot of irritable bowel syndrome is actually just a bacterial overgrowth. So if these markers are too high and the patient has a lot of bloating, gas, intestinal discomfort, then we know that they have what we call SIBO, or small intestinal bacterial overgrowth. Next are Clostridium markers. Clostridia bacteria, as you can see with this patient, hers is really high. And this is the fascinating thing with this marker, is that Clostridia will actually block the production of dopamine and block the conversion of dopamine over to epinephrine and norepinephrine. Why is that important? Well, those are three of your main neurotransmitters, along with serotonin, in the central nervous system. So a lot of people with depression, anxiety, have a Clostridia overgrowth in their small intestine, and they're just literally not producing enough dopamine, enough norepinephrine, epinephrine. So as you can see here, she has a Clostridia overgrowth in her small intestine, and this is just so amazing, because now we know why she's feeling depressed, or why she has those moments of anxiety, and we have a clear treatment that we need to go after and get rid of this, and then those symptoms will go away, because once the Clostridia is cleared up, then her body will naturally start making dopamine, epinephrine, and norepinephrine again. So we'll move on down to the next section here. Up here, these are oxalate markers. So scroll up here, yeah, oxalate metabolites. So this is huge in patients with fibromyalgia. So think of oxalate crystals like kidney stones. The thing is, kidney stones can get deposited anywhere in the body, in the muscles and the fascia, and it can create a lot of fibromyalgia-like symptoms. So when we see high oxalate metabolites here, we know that their body's producing too much, either through dietary intake, or it can be produced from Candida and parasite growth. So if someone presents with fibromyalgia or chronic pain, this is a big marker we need to look at to see if that is a problem with their dietary intake, or if we need to look at Candida infection, which we just covered, or if we need to look to the large intestine and see if they have parasites. So as we move down here, we can look to see how the body's metabolizing energy. So that's what the mitochondria do. Mitochondria produce energy within the cell, and you need to be able to use glucose, and you need to be able to use fats and amino acids for energy. So we can look at these, and you can see, she's trying to lose weight, and she has feelings of being really hungry throughout the day. You can't go more than 3 hours without eating. Well, the problem is she can use energy. She can use glucose as energy, but as soon as she starts switching over to like amino acids, these Krebs cycle markers, and fatty acids, she can't utilize those for energy. And that's being picked up here on this organic acid test, that her mitochondria just aren't efficient at burning energy effectively. So if we just keep going down through there, there's some more mitochondrial markers coming up, but we already see that she can't burn fat very well for energy. So she's going to have a hard time doing any type of nutritional plan, because as soon as she runs out of glucose, she's going to really feel hungry and really need more fuel when she actually has plenty of fuel in the form of fatty acids she just can't tap into. So neurotransmitters, so this kind of piggybacks that Clostridia overgrowth. So I want you to look at these two right here. 0.74 is definitely low, and that's her dopamine level. So she's not producing enough dopamine, which is your motivational center in the central nervous system. So if you just, those feelings of depression and anxiety, lots of times it comes from a lack of dopamine. And she's on that low normal, so 0.48 is pretty close to 0.46. So like we said before, when you have Clostridia, it blocks a lot of this production here. So she's low in dopamine, norepinephrine, and epinephrine. Well, there you go. That solves her depression, anxiety issues right there. It's not that she's lacking antidepressant medication. It's because she has Clostridia overgrowth in her small intestine that we need to address. And we clear that up. If you get rid of the toxicity here, then her body's going to go back into balance naturally. Then we have our tryptophan markers, so basically serotonin, and you see her serotonin levels are pretty good. No real issues there. Her imbalances up here, like we just said before. So for her, this is what we're going to target, fixing her gut and giving her some dopamine supplementation to make her feel normal and just have less depression, anxiety. So we have folate markers. Folic acid, see if you are producing enough of that, and she's fine there. So again, back down to ketone fatty acids. So when I was talking about producing energy in the mitochondria, you can see here her fatty acid oxidation. When she runs out of glucose or blood sugar, she goes to burning fat for energy. She literally can't do it, and that's why a lot of people with these type of markers have a hard time losing weight. When they get past 3-4 hours after eating, and then they just really struggle because they're so hungry. They get fatigued, and they just get hangry sometimes, and this is why. So we can supplement and fix this, but we need to know if that's an underlying issue or not. Some nutritional markers. So you can see she's low in vitamin B2, riboflavin, and she's low in vitamin C. So a couple other nutritional deficiencies that she's having, and you need these markers to produce energy in the mitochondria as well. So glutathione's pretty good, which is a strong antioxidant. Coenzyme Q10 is pretty good. So again, just some nutritional markers we pick up on the organic acid test to see if you're utilizing these appropriately in the body, if there's any deficiencies. Then some indicators of detox here in the liver. So we just got some markers to make sure that the liver is working appropriately, and it is with her. So just another great test to figure out, if detoxification pathways are an issue in the liver. And then just some amino acid metabolites, so nothing too major there. And this is an indicator of vitamin D. So if phosphoric organic acid is low, then we know that she needs to supplement vitamin D, and she doesn't have enough of that to metabolize these acids appropriately. So as you can see, the organic acid test is just a phenomenal test for those with chronic illness, whether it's pain, fatigue, weight loss issues, thyroid issues, irritable bowel, digestive issues, autoimmune issues. So this is one we run almost 100% time on patients that come in for functional medicine. So I hope you learned a little bit from this, and we'll see you on the next video. Thanks for watching.